We're going to talk about the reduction of the dislocated temporomandibular joint when the patient is sitting down. So we're going to talk about the position of the patient and the position of the dentist and how it's done. The patient must be sitting down on a chair, a dental chair, and his head is well supported to carry out the reduction of the temporomandibular joint dislocation. And the dentist must stand in front of the patient and place his thumb on the external oblique ridge or the occlusal surface of the lower molars. As you can see here, this is the external oblique ridge or the occlusal surface of the lower molars. If the dentist puts his thumbs on the occlusal surface, he must be aware that the patient may bite on them. Place your fingers under the patient's chin. So the dentist puts his fingers under the patient's chin, okay, and apply pressure with your thumbs in a downward direction. So the dentist presses here, okay, downwards. So apply pressure with your thumbs in a downward direction and with your fingers in an upward direction. And then start pushing backwards to put the condyles back in its normal position. You might find it easier to replace one side first and then the other. Once relocated, continue with the upward pressure on the chin for about 1 minute to prevent the patient from opening their mouth. Advise the patient to avoid wide opening for 24 hours. So we advise the patient to avoid wide opening for 24 hours. So this is how it's done. Thank you. This is how to make reduction of the dislocated temporomandibular joint. Thank you for listening and goodbye for now.